All right, now that I have my client in a supine position, we'll show a little bit of anterior work. Just in case I forget, let's do joint play first. Notice what I did for the draping technique here is sort of got underneath the gastrix, got myself really underneath there, and then work my way up towards the knee so I can pick that knee up. Do that draping. My client doesn't have to do anything, which is good, because if she did have some instability within her knee, moving it's not going to feel super great. All right. Bolster up out of the way a little bit. Get my client into a knee flex position. So we're going to do an anterior glide to start. So I'll palpate the tibial tuberosity. So I can feel the tibial plateaus on either side. Start a little bit more grade 1, grade 2. Just a little bit of movement. Moving to a little bit more rigorous movement. Get some oscillations going. Does that feel okay on the table?
Mm-hmm.
Using my whole body to accomplish this. Posterior glide just going the opposite direction. Hold that for about 30 to 45 seconds, or oscillated for about 60 to 120 repetitions. So we have a roll and glide in the same direction for the tibiofemoral joint. So by doing anterior glides, I'm going to increase anterior movements, and in contrast to that, doing a posterior glide will increase posterior movements. Fix this drape a little bit. And I'll put this bolster back. Okay. Let's make sure I can see my client's patella. Bring it over a little teeny tiny bits. Okay. Patellar mobilization. You can see that pretty well. So let's test out some of the ranges here. So lateral, medial, superior, and inferior. If I take a quick look at her ankle, you can just bring it into a little bit of passive extension here. Her knee goes straight up. Her patella goes straight up. She has a little bit of natural external rotation in this hip, and this wasn't actually the leg that we worked on with the other one, whereas we can see here, actually still fairly externally rotated. So yeah, we'll do. We got lots of room going medially, so let's go laterally and let's give that stretched out a little bit. So I'll move my right hand just so we can see a little bit. Coming this way, I'm going to use both hands so I can keep it nice and supported. Does that feel okay? Mm-hmm. Patellar tracking disorder, patellofemoral pain syndrome, chondromalacia patellae. These would be your go-tos. Get a little bit of movement within the patella. And take it back medially. It's going even better medially, but it's going pretty darn good laterally too. It's even to the point where I can even feel a ridge. Feel the ridge of the suprapatellar tendon on the lateral side. And we're moving it quite a bit. I know when you saw it on the video, probably looking at it right now, it probably looks gross. But our client is super relaxed. She's okay with it. Yeah. Now I can see how much more movement there is. See if that changed any of the mechanics. So, just, there we go. Now it's going a little bit laterally as it's tracking through. Just got a good release there. So yeah, we'll do a little bit of skin rolling across these areas here. Pick up some of the skin and fascia over top. Attempt a little bit of a SIBO on the quads, mainly because it was requested. Not the most effective, but it's there. How does it feel?
Okay.
It's okay. Some espo across the quads as well. Not really my jam. What I might consider doing is just bringing my client's leg out to the side again. This bolster's in my way.
Mm.
So they got still a little bit of a flex position, but let's say as I do a little bit of stripping to lengthen out the quadriceps, I can get my client to actively extend her knee while I'm doing that. So, start stripping. I'll just ask you to straighten your knee out and relax, and straighten, and relax, and just do that on your own time, nice and slow. That nice and lengthened out. Keep going, please. Body mechanics are a little bit compromised in this position because I have a fairly narrow table. But I want to make sure that my client's legs keep nice and stabilized. But because I'm doing this actively, it's going to amplify the amount of pressure that my client feels. So I don't need to use soul crushing pressure in order to be able to accomplish this. Okay, let's pick the client's leg back up. We'll just get the bolster back underneath her knee. Do a little bit of petrissage here. If we had a chronic MCL sprain, could do a little bit of cross fiber action within this area, try to bring back a little bit of extensibility to it, so long as it hadn't been completely severed and it is now fully healed up. Just a little bit of cross fiber work here. Our tendinopathies. So what I can do here is just sort of go across with my thumbs like so. Just got a little bit of a scab there, so I'm going to try and keep mindful of that. Bring back a little bit of extensibility here. We'll go a little bit above it too. Some stacked hands might be a little more comfortable for me. No, turns out this isn't too bad though. Just let myself sink in for a little while. Get some good cross fiber action in there. I'm going to press a little bit on a little bit of compression up at the TFL here. But you can also try doing two. This one's a little bit tougher to pull off, but what I'll do is I'll attempt a little bit of a cross hand stretch here. So I'm going to use. Can you jump either?
I stretched out yesterday.
Okay, we're going to try it. So this is obviously working within the abdomen, completely draped, but I mean we're still working within the abdomen, so it can be a little bit more intense than what folks are typically comfortable with. But I could do a cross hand stretch here, nice and light up by the abdomen, applying more of my force going downwards. Just do a big cross hand stretch across that TFL. Does that feel stretchy? Sweet. Again, really beneficial for those ITB folks. A little bit of muscle separation on the lateral side of the thigh here. Pick that IT band up or off that vastus lateralis. Obviously compression, that kind of stuff is a given. There you go.